Welcome to the Community Health Worker Training, Cardiovascular Health and Diabetes Training. These mini modules are designed for you to review before class, and remember that there are activities and an evaluation of each mini module on Google Classroom, and you should complete all of these before class. During class, we'll have a chance to get into the information in more detail, answer any questions, and then practice applying it as you'll do one day with your clients as community health workers. This publication was supported by the Cooperative Agreement numbers NU 58 DP 00653-1-02 and -00 and NU 58 DP 006618-02-00 funded by the Centers for Disease Control and Prevention. Its contents are solely the responsibility of the authors and do not necessarily represent the official views of the Centers for Disease Control and Prevention or the Department of Health and Human Services. Module 1 explores stroke as a component of chronic health conditions. During this mini module, you're going to learn the definition of stroke, understand what causes stroke, and describe the two kinds of strokes. So a healthy brain relies on blood vessels that carry oxygen and nutrients to all parts of the brain. If you think about blood vessels as a river flowing through the body, the blood vessels carry the blood that has a lot of different components in it, and one of the components is oxygen, another one is nutrients. And those components help all of the organs and all of the tissue in the whole body to function effectively. And the brain needs oxygen, needs nutrients just as much as any of the other organs in the body. So if that blood flow to the brain is interrupted, parts of the brain can die and lose their function. And this brain tissue death can be permanent, or in some cases it can be reversed over time. And it all depends on how big the blockage is, how big the interruption of blood flow is, and for how long. So what is stroke? Stroke is a disease that occurs when blood flow to the brain stops or is interrupted. And here you can see in this picture that the carotid arteries are the big arteries that bring blood supply from the heart up to the brain tissue. And they then get smaller and branch off into smaller arteries that supply blood to all of the tissue of the brain, all the different parts of the brain. And there can be an interruption of blood flow to part of the brain that can happen in two ways. The first most common reason is a blood clot can block off a particular blood vessel. And that blood clot basically can stop either all of the blood supply or most of the blood supply to that particular part of the brain. And the interruption of blood to that part of the brain can be permanent, or it can be reversed in some cases. And we'll talk more about that in a future module. The second cause of stroke is a hemorrhagic stroke, where a blood vessel in the brain actually ruptures, and the blood that should normally continue on in that blood vessel out to the parts of the brain that need it instead leak out of that ruptured vessel. And so not only does that cause bleeding into the brain and pressure into a part of the brain that normally wouldn't have it, but also the blood flow that normally would flow through that blood vessel is interrupted. Stroke is the second leading cause of death worldwide and the leading cause of acquired disability in adults in most regions. Let's explore these two causes of stroke in more detail. So the two types of stroke, or the two causes of stroke, are ischemic and hemorrhagic stroke. Ischemic stroke is the most common cause of stroke, and it's about 8 out of 10 of all strokes. And this is the type where a blood clot forms in the blood vessel and prevents the blood flowing to the tissue in the part of the brain that vessel would normally supply. And ischemic basically means the death of the tissue from a lack of oxygen. The second and less common type of stroke is a hemorrhagic stroke, when a blood vessel in the brain bursts and the blood leaks into brain tissue, which is not where it normally is. Sometimes people refer to this as a brain bleed or a brain hemorrhage. And part of the problem with this is that it puts pressure on those tissues in the brain from bleeding into them, and the pressure can cause damage to the brain, as well as the damage that's caused by the fact that the blood that was supposed to go to other tissues in the brain doesn't get there because it's leaking out of this rupture in the blood vessel. According to the American Stroke Association, hemorrhagic strokes account for less than 15% of all strokes. So blood clots are the more common reason for stroke, and hemorrhagic or vessels bursting are much less common reasons. So let's watch a video to give us a better sense of how ischemic and hemorrhagic strokes affect the brain. Click on the link at the bottom of this slide, and it will take you to 2 short videos about stroke that give really good animation so that you can picture exactly what's happening. When you get to the page, you'll see that you have to scroll down a little bit to click on the first video, and then scroll down a little bit to click on the second one after that, and then come back to the PowerPoint. Congratulations on completing the first mini module, 1A. Now you can explain what stroke is, understand the 2 kinds of strokes, and explain the 2 different kinds of stroke to another person. The next mini module is mini module 1B, stroke risk factors and warnings. And remember that once you complete all 3 mini modules about stroke, you should go to the Google Classroom to complete the assessment, which is a little post quiz to assess what you've learned about stroke.